ViewPoint project still, in my role as Chief Radiologist at Sutter Health, is still one of the best programs that I've been involved in my tenure here. We initially started out with our ViewPoint implementation limited to 1 or 2 rad codes. I think we thought that it was initially suited best for just an OB ultrasound, and we expanded it to an earlier OB ultrasound. But as we started to learn about the tools, learn about the advantages of ViewPoint, we started to expand it into other rad codes in ultrasound. And now we have all of our ultrasound practice running through the ViewPoint workflow, everything from OB to abdominal imaging, breast imaging, pediatrics, basically everything, and capturing those benefits today. Well, there's been a number of impacts, and what's great about this program is that it not only impacted the radiologist satisfaction and productivity, but also our technologists were more productive, and our patient care we're providing through ViewPoint is improved. On the technologist side, we did some time and motion study that showed that an ultrasound tech working with the ViewPoint workflow was actually 2 times more productive than they were in our previous workflow. A lot of that was due to having measurements and data coming across in an automated fashion, and the illustrations in a way that allowed them to be more productive. And that was really great. When we spent our time looking at our technologists and how their workflow changed, yeah, they were more productive on the scanning side, and they were happy about that. But it also gave them a little bit more time to be human with the patient, walking them back to the exam room, talking to them a little bit more about why they were sent in for the exam that day. So it drove some satisfaction of our sonographers in addition to that productivity. Turning to the radiologists, that we were now 2 times more productive, 2 times faster from begin dictation to signing report than we were in the previous workflow. And what that allowed us to do, and this was my experience, and it still continues to be today, I spend a lot more time looking at images now than I do dictating data elements and double checking that the voice recognition got those data elements accurate. So I get a lot more satisfaction out of my ultrasound practice because I'm looking at images, I'm really studying those, spending some additional time comparing to priors and things. I think my quality is improved as a result of that. And then at the end of the day, the report that goes out to the referring physicians, we've heard a lot of feedback from our referring docs that the automated, sort of structured report, I should say, that comes from ViewPoint with data elements in the same position for every report, and the accuracy, of course, really allowed them to take care of their patients better. So again, as I said, this is one of the best projects that I've been a part of, really all the way through to the patient care impact. We're more productive overall, so that's a key, especially now where we're experiencing a dramatic shortage of radiologists. We're able to get through the volume a little bit faster. Volume is increasing, and so we're able to keep up with that, I think, a little bit better through the use of ViewPoint. Our technologists being a little bit more satisfied in their job is just critical. I mean, everyone knows, I think, that the sonographer job is very difficult, not only physically, but also the demands of getting through a number of patients every day, and just giving them a little bit more satisfaction, allowing them to tie a bit more into the purpose. Why did they go into this field? I think this is really, I don't want to overstate it, but a technology tool that allows the patient to spend a little bit more time thinking about the patient and actually scanning as opposed to clerical data entry. I think that is really key to, again, connection to purpose and why they're doing what they do. Ultimately, knitting all those benefits together, we've seen a benefit on the financial side as well. The productivity gains and the ability to capture the technique statement in a way that's actually accurate as opposed to perhaps leaving out some elements. The impact on our ultrasound practice has been significant. Yeah, absolutely. We spent some time studying this, and I was really surprised about the outcomes here. One of the things that we know is that the job of coding and billing can be challenging, especially when the coders and billers are working off of a radiologist report. Today, to be fair, a lot of that's being done by NLP, but still there is an opportunity there where the radiologist may not capture in their dictation all of the technique that was actually being performed by the sonographer. And prior to ViewPoint, that resulted in lost charge capture. In the cases where our human billers and coders were able to catch that omission by the radiologist, they were sending it back to us for rework, for an addendum. So it was a lost economic opportunity, and the burden of rework is something we're always trying to eliminate. So when we were able to use ViewPoint to accurately capture what the sonographer did as they were scanning, for example, the addition of color Doppler and spectral Doppler, or transvaginal in addition to transabdominal scanning, what the sonographer actually did as they were scanning was captured accurately in ViewPoint, and that flowed through to the radiologist. Now, we don't actually have to dictate the technique section. We just have to double check that the images are there. And when we focused our study on a region that where we perform a lot of vascular exams, for example, we found that over a course of 6 months, a seven-figure, over $1 million of additional charge capture and accuracy as a result of implementing ViewPoint. I hope that our experience can be useful to you as you encourage other customers to dive into ViewPoint, not only for its use in OB ultrasound or some of the historical ways in which this tool was used, but really to look at the entire ultrasound practice and the ways in which you can really evolve through the use of this technology. So I appreciate the opportunity to share some of those benefits with you.